Time of the day, everyone. My name is Ali Buzurukov. I'm the chair of the Inter-Agency Humanitarian Evaluation Steering Group. I'm also the head of OCHA's Evaluation and Oversight section. It's a pleasure to welcome you today to the webinar on the IAHE of the Collective Humanitarian Response in Somalia, which was published last year. It's one of the in the series of dissemination events. We have already had a briefing during the Humanitarian Partnership Week in March, and there will be other targeted donors such as donor briefings. But this one is the most public event where we would like to invite anybody interested in the response. And I think that the the response we will be discussing today in Somalia offers highly relevant questions, not only for the Somalia context, but for the global humanitarian context, which goes beyond Somalia. Um, just a couple of words of what the IHEs are. IHEs are Interagency Humanitarian Evaluations. They are independent, commissioned by the IHE Steering Group, which is the IEC associated body, to strengthen learning, accountability, and evidence-based decision-making across the humanitarian system. And we believe that in the time of rising humanitarian needs, widening funding gaps, and sector-wide humanitarian reform, the IHEs are important more than ever, as they provide the essential evidence that will help the system, or we so hope, to adapt state principle and deliver better results. I'm also thrilled today that we have our three panelists. Julia Stitz, director of the Global Public Policy Institute based in Berlin. She is the leader for this evaluation. And Julia has a lot of experience conducting evaluations in international development, humanitarian assistance, public-private relationship, monitoring and evaluation. She's very well known for her commitments for impactful evaluation, ensuring that they lead to meaningful change. Actually, Julia is one of the few evaluators that we know who won't agree to a project unless she's convinced it can truly make a difference. And it's true that took some convincing before she agreed, but I think it was largely helped by the very principled and enthusiastic position of George Conway, Deputy Special Representative of the Secretary General to the United Nations Assistance Mission in Somalia, also resident humanitarian coordinator. He has several decades of experience in development, crisis prevention, and humanitarian affairs. He's particularly had a lot of experience in Somalia. He knows Somalia in various roles. In that sense, the Somalia country team was very lucky to have such an experienced leadership at the realm of the crisis, at the height of the crisis. And he's one of the few humanitarian coordinators, not alone. There are several others, but he's particularly stood out because he not only agreed to the evaluation, he demanded it. And so we have to prioritize our limited resources as well for the Somalia. So I think it was a good match between Julia and George. So I'm also pleased to have our third panel member, Nima Hassan, who's the director of the Somalia NGO Consortium. Nima represents the voice of frontline NGOs, without whom humanitarian action would not have reached so many communities in Somalia. Established in 1999, Consortium has grown into a large network of non-governmental organizations working together to improve the international aid coordination and strengthen NGO representation within the aid architecture. So I'm sure, Nemo, you give some headache to George time to time. And she has also over 15 years of experience in humanitarian development programming. So today we will begin by a short presentation by Dr. Stitz, and she will walk us through the key findings, conclusions, and recommendations. And after that, we will hear from the panelists. And at the end, we will have about 10 minutes or so for the questions and discussions. Please feel free to submit your questions to the panel in the chat using a function. You also have an option to vote for the question you like, so that way we can maybe prioritize questions that get most votes, and we have some team members monitoring the chat who will identify the most common questions, so that we can have few but perhaps top questions answered at the end by the panelists. With that, without further ado, I hand over to Julia to run us through the key findings and conclusions of the evaluation. Over to you, Julia.
Well, thank you so much, Ali, for that very kind introduction, and thank you everybody for joining. These are pretty challenging times for the humanitarian system, so I'm very encouraged that you are all here to listen to the evidence we have, and hopefully together we can try and figure out how we can use that to give the changes that are ongoing direction, rather than just standing by and seeing what happens. Let me start the presentation, and I hope you can see that.
Yes, Julia, we can see it.
Great, but I can't, yes, here, and I can control it. As Ali said, this is an interagency humanitarian evaluation. The humanitarian system, in my mind, is quite special because it actually does systematic evaluations. And these interagency evaluations are a great case in point. They are commissioned by all the UN agencies together, or most of them. They look at the system as a whole, and as evaluators, they give us a really unusual chance to find out generally, did a response work? How can we improve the system? And so I found it a great privilege to be able to conduct this evaluation together with my colleague Elias Sackmeister from GPPI and the Somali organization Raksan. Just a very brief word on context. I think you all know that Somalia is a country that has been in crisis mode for a long time. It has gone through several large-scale famines in the past, and it was hit a couple of years ago by the worst drought in over 40 years, and at that time famine was predicted. At that moment, a system-wide scale-up happened that led to a massive injection of additional funding, mainly for food security interventions, and to a great scale-up of activities happening under very challenging conditions. I'm thinking here in particular about the insecurity and the strong movement restrictions that aid workers face. So what did the evaluation find out? Firstly, and I think at this point in time, most importantly, we found out that it actually worked. It made a massive difference. The humanitarian assistance and that scale up that we witnessed helped to avert famine. Famine was not declared, even though we had excess mortality of still around 75,000 people in 2022 and 2023. We have clear evidence that without the assistance, tens, if not hundreds of thousands of people more would have died. What is this evidence? Firstly, we have millions who received food assistance, and we have monitoring evidence that shows that their food consumption improved. We had around 1.5 million children with acute malnutrition that received treatment, and over 96% of them recovered. We also asked affected communities what would have happened without the aid, and in a great majority agreed that many more people would have been displaced and many more people would have died without it. So a really important point, generally speaking, it worked. It made a huge difference. Of course, now we come to the but. I'm an evaluator, so I'm always also looking for the things that worked less well or that were unintended. And the first point I want to mention is that the assistance did have significant unintended side effects. Now, if you are in a situation where getting assistance is a matter of life or death, then where you can get this assistance will determine where people go to when they displace. And in Somalia, This was to hundreds of informal settlements, often in very precarious situations with dreadful conditions. And it is in those conditions that we saw these excess deaths happen. Also, these settlements are often on private land, and the tenure is precarious, so it's a very bad condition to find more durable solutions to strengthen people's resilience. And in addition, the way the aid was targeted meant that it had negative incentives for people's resilience. So it prioritized people who were newly displaced, and that led to some people who already lived in better places to go away from there and move to these very precarious sites. And what we take away from that is a general sense that humanitarian assistance should pay a lot more attention to the kinds of incentives it creates. And also a takeaway to say, there's a lot of talk at the moment about refocusing on short-term life-saving assistance only. But what we always hear is that looking after the resilience, transitioning out of that survival aid and towards more durable solutions is actually more important to people. Another side effect was that due to this big influx of additional resources, the risk of aid diversion also increased. I think that's quite normal, that if you have a context with weak governance and widespread corruption, you add a lot of additional money, your risk of diversion goes up. There was an investigation commissioned by the UN Secretary General that led to a joint reform effort in Somalia, and that is something we can really learn a lot from. One thing we learned, thank you. I was about to say that there's a lot we can learn from the joint effort in Somalia to deal with this increased risk of aid diversion. And one is that system-wide, really, we need to pay more attention to mitigating this risk when there is a scale-up. It's also that doing such a joint approach as they did in Somalia is really important to build trust, to create transparency and cooperation. But also that making progress in the joint approach is really hard and requires support also from the global level, for example, on key issues such as data sharing and beneficiary registration. Another finding, which is on the next slide, is on coordination. Now, firstly, we found that good coordination is needed. We do find that together with good leadership is really what led to innovations and good practice in Somalia. But overall, we found a coordination system that was way too heavy, that was complex and duplicative, that created a lot of guidance and strategy, but it wasn't always clear how that was being implemented, and where data was still a weak point, so even basic information was disputed or contradictory. Our takeaway is that it's important to cut the coordination clutter. For Somalia, we recommended to cut the number of fora and meetings by at least 50%. Let me get to the next issue now on the next slide, which is about accountability. And this is something we really need to talk about. We found that there were gaps in accountability on two levels. One is that we do have a lot of diagnostic tools to understand what is going well and what is not going so well. But what we don't have are the tools to then make sure we follow up on them. And I'm very happy to see, and we will hear more from George, that actually for Somalia, we do get a lot of response now and actions to the evaluation findings, but many of the things we identified in this evaluation had been there for a long time before. And one example of that is accountability to affected people. It's been on the table as a weak point. It has seen important investment, especially in hotlines and feedback mechanisms. But on the whole, these mechanisms proved not to be very effective and also proved to be very fragmented. So a question here is, how can we get to a working, maybe even a collective accountability to affected people system? Another issue I'd like to look at on the next slide, and which is one which we see as a strong point. And I think it jumped something here. Could you try and go one level back, please? Oh, no, sorry, it's fine. This was the right slide. The strong point is that there was a very clear prioritization taking place during the response. And this is a theme that I think resonates a lot today, where we may need to prioritize more. The priorities that were being defined were the classic life-saving ones. So food security, health, nutrition, and WASH. In the actual implementation, what we saw is that WASH lagged behind the other areas in scaling up, and that then led to a lot of very negative consequences to people. And one thing I want to mention is that we saw from the Somalia Humanitarian Fund, which is a pooled fund instrument, a very strategic focusing in on WASH, which was important, but also limited because the Somalia Humanitarian Fund accounts for only a very small share of the overall humanitarian response in Somalia. To go on, and that's another strong point, or one where we have seen progress, is that the response has made progress in reaching marginalized people belonging to minority or marginalized clans. You can see how this issue over time came up, and then you see more representation of people from marginalized clans in the humanitarian system, all the way through specific measures to then identify and serve these people. And we also noted that when we asked people about how satisfied they were with the response, we got more positive responses from people belonging to minority and marginalized clans. So a clear story of progress. The downside, perhaps, is that there was no similar push on gender or disability, so other inclusion issues. And the efforts to expand assistance in areas that are hard to reach had more difficulty in reaching progress. Where we did see progress, local organizations played really a key role in making that happen. And what we noted was that even though we've had a global commitment to increase localization for a long time now, there was still very, very little direct funding to local organizations. And again, a noticeable exception was the pooled fund, the Somalia Humanitarian Fund, which in 2023 already allocated over 70% of its resources directly to local organizations. So this is an interesting model, perhaps, that already exists, which I think going forward, it would be good to see a lot more of. A final point I'd like to make is about security management. This is something that came up whenever we tried to inquire why certain issues weren't addressed, or why there was not as much progress perhaps made as we would wish for, from addressing aid diversion to accountability to affected people. We always came back, at least as one of the factors, to security management. Security management among the UN agencies in particular, but also among many international NGOs in Somalia, relies very strongly on hard security measures and leads to very little international field presence. It has also led to the number of attacks going down and the risk really shifting almost exclusively to national aid workers. It makes operations very costly, and it raises questions about humanitarian principles. And we felt, there was a report a long time ago called Stay and Deliver that tried to outline a vision of how the UN could sort of combine these different elements. And we are asking, what happened to that? How can we resurrect that? I will leave it at that. I really look forward to discussing what some of these findings mean for Somalia and for the humanitarian system more generally. Personally, my takeaway is that, yes, we see that things do need to change, and in some areas they need to change fundamentally. But we should not forget that what we have here is a system that has proven that it can work. It works in preventing mass fatality events, and I would say at a cost that is really not the world. Thanks very much, and back over to you, Ali.
Thank you very much, Julia, and apologies for the technical glitch here. But as you could see, Julia can summarize a lot of information in a very just few slides, so we gaining on the time. So now we're turning to our panelists for their reaction. We'll be curious to hear about your reflections on the evaluation and how you're using the results. George, probably turning to you first, then Nemo. The evaluation shows that the humanitarian response in Somalia was fairly successful in helping to avert famine, save thousands of lives, if not hundreds. The collaboration was quite strong. There was a quite timely and a rapid scale up. And the system demonstrated some flexibility and innovation. Despite all the challenges, but there were also some shortcomings, as we just heard from Julia. What was your first reaction to the findings and conclusion, and how did you find the evaluation process itself helpful to what you were trying to do to improve the humanitarian response in Somalia? Over to you, George.
Thank you, Ali, and to the organizers for this discussion. And really grateful for the opportunity, and tremendous thanks to Julia and the evaluation team for what we felt was a robust evaluation exercise that really undertook extensive consultations quite broadly across the country, including in hard-to-reach areas, and has come up with what we feel to be a very valuable set of recommendations that we agree with. I do appreciate, in the first instance, the validation that an independent evaluation of this nature has provided in terms of the impact of the scale-up in preventing worse levels of mortality. And likewise, appreciate the validation where improvements in terms of, for example, inclusion of minority clans, or in some cases positive spillover effects for the Somali economy, the advances in localization made possible by the CHF, the Common Humanitarian Fund. These are all good to have evidence on now. At the same time, we appreciate and we agree with the areas of challenges that were identified by the evaluation itself. And many of these were already known to us, but some helped elevate issues and brought them into further focus and higher on our collective agenda to ensure that we are working meaningfully to ensure that the Somali people get the best possible response, that we can work with the authorities and local actors to promote and support. And so a lot of the findings are very salient in that respect, including the issues around the risk of undermining resilience building. That was noted, the challenges around accountability to affected populations, with which we agree, including this proliferation of feedback mechanisms that's ineffective and inefficient. The issues around aid diversion that have been long-standing in Somalia, but really needed to be brought into clearer focus in terms of the political economy surrounding aid in the country, and the widespread measures that are necessary to try to interrupt this phenomenon. And of course, the issues around, in particular for the UN actors, our security posture, and what that means, and what are the institutional changes that we have to make. And let me just start again by saying, the humanitarian country team as a whole has fully endorsed the recommendations and the findings that came out of the evaluation. We had already started working on a number of them in advance, especially issues around aid diversion were brought very clearly into focus by the report to the Secretary General. But at the same time, a lot of the issues around aid diversion also tied into efficiencies, how the system functions, how it needs to function differently now and for the future, including around common challenges such as registration, beneficiary identification and selection, systems for referrals, the ways in which we undertake needs assessments, which all needed significant streamlining, harmonization, simplification. And from this perspective, we do quite feel that the evaluation as it was happening and giving us this live feedback as we were already working through a reconfiguration of the system helped us to start a reform track that was quite robust and solid. Again, building on the strengths of the operation, because as Julia has mentioned, the operation was successful in as far as it prevented a famine, but to address the inefficiencies and the shortcomings that were likewise identified. And we've been working very hard on those now for the past year and a half, with some good demonstrable progress at both policy and implementation levels. So I think there's some of this that in further on in the conversation I'll come back and speak to when we start talking about how this relates to the work of the Humanitarian Reset and the challenges on the current humanitarian landscape. So perhaps I'll pause my comments there, and I also don't want to freeze out any time for Nemo to give her reflections and thoughts. Over.
Great. Thanks, George. Thanks, Ali. Thanks, Juliet. And thank you for inviting and giving us the opportunity to share our experience and perspective with regards to the evaluation from an NGO perspective, both international and national. Yeah, I think I mean in agreement in a lot of the outcomes, findings from the evaluation. You know, it's a far more reflective way of doing, and in terms of the actual process for this particular evaluation. And I was happy to hear from you, Ali, that in your introduction with Julia, that she doesn't take work that it does not have an impactful outcome, and I think that also was shown in the way she approached the task. You know, sometimes a lot of our NGOs, we complain that we're tokenistic and we're not very inclusive in terms of having our inputs. But in this particular exercise, we were part of the whole process. Through the NGO consortium, we organized various workshops, whether it's consultative or whether even through the validation. But also through these changes in the recent years, NGOs are far more represented in the coordination structures as well. So we have local, including women-led, including marginalized representations within the HCT. So that sort of provides a bit more ownership from the NGOs as well. And this is something that the forum facilitates and ensures that NGOs are represented in these various coordination structures. And I think certainly from an NGO standpoint, what we like about this evaluation and this interagency evaluation is the fact that it's based on data and evidence, not just perceptions. So the conclusions are actually grounded by looking at evidence, because and this broader consultation and talking to the community, talking to the various structures and groups within the community, talking to the local NGOs who are at the forefront and has been at the forefront in the humanitarian response in Somalia for such a long time as well. So I think understanding their important role in including in all of these processes from the onset, I think that is something to be proud of with this exercise and process. And in terms of the response and the scale up, absolutely agree. It did avert a famine. And although lives were lost, and I think we should be aiming in a system where we get to where no lives are lost, especially when a lot of these challenges and these droughts are so predictable. We have the tools to predict. We have the tools to address. We have the systems that are there. But sometimes the funding doesn't come in time. Our processes are quite long. So I think, yes, we did avert a famine, but I think still there is a long way to go for us to ensure that no lives are lost for man-made, predictable crises that face communities in Somalia, for example, in protracted crisis. Maybe just a quick point on, yes, it did focus on life-saving activities, and that's what was necessary and needed. But also the negative consequences are that the erosion of resilience, and if we were to advocate from a humanitarian standpoint, we do need the development injection, cash injection to work along with the humanitarian, you need to save lives, but also you need to ensure that communities are building resilience a lot bigger than we usually see in Somalia. And I think things will change. And I'm sure when we talk about the current situation, we'll come to how these funding cuts are impacting our communities. And then a final point on localization. Yes, Somalia does a lot better in many contexts, and thanks to the SHF funding to enabling direct access for local partners who work in very difficult scenarios to actually receive that funding directly. What I would have liked to see from the evaluation is the comparative, comparing it to the broader humanitarian portfolio. It's usually a very small percentage of like 4 point something or 2 point something, as opposed to the bigger, broader amounts that come in through the humanitarian response. So yes, it's a success. It's a success to be proud of, that we're enabling, and the pool fund is enabling for local partners to access funding directly, quickly. It's a lot more contextualized in terms of the areas and locations and how we organize where the funding goes. But in comparison to the bigger funding pie, is very, very small. So I think it's really important to reflect that as well. Again, let me stop here and come back to further reflections in the second round. Thanks, Ali, and back to you.
Thank you, Nima. Thank you, George. Just to quickly underline that how much we in the evaluation community appreciate that when leadership and humanitarian actors actually take time to reflect and take and learn from the lessons from their response. I think both of your comments indicate that we would be better off by confronting the experiences and celebrating our successes, but also trying to fix the mistakes we make. As I like to say, is that the system is not defined by the mistakes; it's defined by the reaction to the mistakes. And I think in Somalia, I think both of you indicating that the humanitarian country team is making a good effort to reflect on the lessons and make further improvements. But as you suggested, Nima, also like it would be good to compare to other responses, because the Somalia experiences has some good innovations, like that. 70% of the funding of the CHF is going to the local actors. I think it's a good standard for the rest of the system. But now we are in a very new environment where the humanitarian funding is shrinking. The system is under stress and under attack, in the words of the emergency relief coordinator. So it would be good to speak a little bit about what these lessons from this IAHE mean for the broader humanitarian system. Because traditional ways of working are increasingly unsustainable, reactive, and might be not adequate to this new situation. I would like us to maybe start with you, George. Can you tell us how the situation is evolving in Somalia? I know the emergency relief coordinator asked your team, as they did ask all other humanitarian country teams, to better prioritize given the new situation. So what are discussions about how the system has to change in Somalia you are discussing, and what maybe some thoughts about the broader humanitarian system adaptations that is required? Over to you, George. Can you unmute yourself?
Sorry about that. No, thank you very much. And one of the things that I think is very useful about these types of evaluations is that they, in fact, give both observations and recommendations specific to this response, but also identify system-wide issues that can be elevated up to the appropriate structures, in this case, directly to the ERC, the Emergency Relief Coordinator, and to the IASC and its associated structures. Because there are a number of issues that have been recurrent in these evaluations over the years, and the system, has needed to get ahead of. Of course, as you say, this very radically changed financing landscape in which we find ourselves over the course of the last months has triggered the ERC's Humanitarian Reset process. And to a certain degree, I feel that we're a little bit ahead of the curve in Somalia because we've been really working dedicatedly on these issues over the course of the past at least year and a half, which coincided with the actual undertaking of the evaluation and the live feedback process that we had from the evaluation, which then helped us to point ourselves in a direction of identifying solutions to many of the challenges that, number one, both showed up in the IAHE, but also have showed up in the Humanitarian Reset process and the requests from the ERC for simplification of processes, including around coordination, for finding better efficiencies across both clusters and organizations. And a lot of this we'd already started working on. So, we just a word on Somalia, of course. The situation continues to be volatile, both in terms of a situation around, right after the worst drought in 40 years, we had the worst floods in 100 years. At the end of 2023, 2024 saw variable rains that saw food insecurity start to creep up again. And in recent months, we've also seen food insecurity continue an upward trend after a significant reduction when the rains came in 2023. And so we are concerned that the current humanitarian situation in the country remains very complicated. And at the same time, as we're facing a massive reduction in available financing. Right now, today, our 2025 humanitarian needs and response plan is 10% funded. And we're planning for a scenario in which at a best case, we'll have 25% of the target. And that means a massive reduction in terms of support to people in need. Upwards, we estimate, of about 50% of a reduction in beneficiaries. And these are hard discussions to have, and we're having them at a system level in terms of how do we prioritize, where do we prioritize, and we've had extensive discussions both with the NGO community, with the government itself, and down to subnational levels to verify and validate our course of travel here. So on the one hand, we are radically focusing the response, and we've been through a radical reprioritization process, focusing essentially on people in IPC 4 and above, food security, emergency and above. But a lot of that IPC 3 category of people in crisis, the system is no longer able to support in the same way, focusing on those in severe acute malnutrition. As well as more geographically focused on areas that saw the highest levels of mortality in the previous drought cycles. So there's been a real sharp focusing of the response as required, both by context and at the request of the Emergency Relief Coordinator. But at the same time, we've been looking at our systems, we've been looking at our mechanisms, and we've been looking at where can we find greater efficiencies, where can we find greater cost reductions, cost savings, so that more money goes into the direct response to people and less into the system itself. We had already been working on, and this was identified by the evaluation, an overly complicated coordination apparatus that we have issued new policy at country level on earlier this year that simplifies the structure while maintaining the quality assurance of the clusters in terms of the substantive content of the HNRP, focusing very strongly on decentralizing and localizing coordination structures to area levels, and empowering local actors to drive responses more than was the case in the past, where it was a very centralized, a capital level directed response. We've made significant shifts in terms of how we target beneficiaries, how we register beneficiaries to address targeting to address what we found to be significant inclusion and exclusion errors, especially in people that should be getting assistance that weren't. So really enhancing our ability to get aid to the people that need it the most, simplifying and harmonizing registration processes and needs assessment processes, so we don't have duplication of clusters doing their own things and separate assessments. And that provides a significant both efficiency saving as well as a better interface and better accountability to communities, and improving data sharing amongst all of the partners as well, to ensure that we're working with a common understanding of what community needs are and have better systems to refer unmet needs across the system where we need to. So all of this is entirely resonant with the Humanitarian Reset and its pathways. And I think it gives us a good opportunity both to ensure that in a restricted financial environment, money gets to those that need it the most in the best targeted ways, that avenues for diversion are minimized and addressed, and that as a system, we're operating at far greater levels of efficiency than we had in the past. And I think that brings us all close together. On the localization agenda as well, again, we continue to increase our ambition. The target for this year for the SHF is 75%. Every year we're increasing the target by 5%. But it's not a big enough component of the overall response. And so our plea to financing partners is, the SHF, the Somali Humanitarian Fund, is a good value-added mechanism for getting assistance down to the levels at which is needed the most. More fundamentally, though, it's clear that as Somalia continues to experience these shocks, our collective focus must be, and I know I'm talking for a long time, but I'll stop soon, on increasing shock resistance and reducing needs and vulnerability for the future. Building Somali self-reliance so it doesn't have to rely upon this large, costly humanitarian set of structures and systems, and really empowering national actors, governmental and non-governmental, to lead support efforts to their own populations. And grateful for NEMO's partnership as part of that process. And with that said, I'll hand over to her.
Thank you, George. Thank you very much. It's great to hear that there's so much work going on already to address the issues identified in the evaluation, but also responding to this evolving crisis. And you mentioned simplifying coordination, more local efforts to localize and channel even more resources to the local NGO, and also emphasizing the role of the country-based pool fund as a tool. And understandably, not you're doing what's possible at the country level, and there's obviously more for the whole system at the global level to do more to support you, but all of it to enable more localized action that partners in the NGO consortium will need to take. You already started even talking about that while in Somalia there's a higher than average, well above that funding of local NGOs from the Humanitarian Pool Fund, but overall funding remains a challenge. With the only anticipated quarter of the funding for HRP, very hard times ahead. So what are your thoughts about how the humanitarian system can do more to support you at the global level, at the country level, but also anything that the NGO consortium and NGOs members have to do more among themselves to prepare for that situation? Over to you. Any thoughts on this? Solve the problem for the humanitarian sector.
Sure. Thanks very much. Well, I think, we're very much involved and to complement everything that George has already outlined in terms of the reform system that we're undertaking about a year and a half ago. And maybe just to mention that the PDAD, the Post-Delivery Aid Diversion report from the UN, initially, NGOs had a negative reaction to it because they were not involved in collecting that data, in contributing to that report, and we didn't actually get a full access on that one. But we quickly got over that, and we wanted to make sure that we're involved in a positive manner in the sense that we contributed to the development of the 10 action points and the reform that we needed to do. So I really want to commend the NGOs for that as well, and putting their effort in supporting the collective to change the system. And we did get to a point where we're like, we don't need to point fingers, but we need to do whatever we can to deliver services to the vulnerable communities that we serve. So with that background, I think there's been a huge contribution in the system reform from the NGO sector, both international and local, to ensure that we support the HC, that we support a collective action, that we're willing to listen, giving our capacities and our time to do that reform, because the most important thing is for us is the best way to support these communities that we serve. And we're a lot more, we need to do a lot more in engaging them and being accountable to them. So yeah, we've been completely part of that, with part of that system change and system reform, looking at the protection issues, looking at inclusion and marginalization issues as well. But these are huge problems. There are problems that entrenched in the last 30 years into the whole system and the environment. And I think it's important for us to take note of that, but to ensure that the system, the humanitarian system, is efficient for us to respond, especially now that we don't have the luxury of funding, we don't have the luxury of time. So some of the conversations we're having internally as the NGO consortium and its members is what are the prioritization, and how do we prioritize? How do we ensure in having a position as NGOs when it comes to the reprioritization and the targeting? And then also, how do we engage? How do we make sure we get a common messaging to the community? So far, the conversation has been limited to the system. We talk to each other, we debate each other, we discuss each other, but how much are we actually sharing what's to come to the community, so that we do not do any harm, and where we live we live well. So that's something that actually we're working with through the HCT as well, but also within the NGO. Other thing is looking at alternative funding. Can we look into the private sector? How do we work with the private sector? How do we ensure that there's contributions? How do we collate? Because actually the private sector and the community are usually the first responders anyway, before any agency goes into support communities in a crisis. And I think something for all of us is how do we ensure that we're getting Somalia is having access to climate financing as well? It's just we're at the initial stages. There's recently been a project that Somalia received from the Green Climate Financing Instrument, but we need a lot more than that, because Somalia bears the brunt of the impact of the climate shock. So how do we advocate at the same time? Yes, of course, NGO, of course, the humanitarians cannot do it all, but we need to have other actors on board as well. How do we bring the development actors? How do we advocate for Somalia? How do we engage the government to advocate for their people? How do we work better with them? We're actually doing a lot better than we did, but we do need to move a lot faster to ensure that we are, in terms of our own internal efficiency, but also we're getting the message across and the gravity of the situation. I know time is running out, so I'll leave it here and maybe provide a space for people to ask questions and come back to us. So back to you, Ali.
Thank you, George. Thank you, Nemo, for very, very good points and clear articulation of them. We have few questions in the chat, and so let me just maybe try with two questions first, and one to Julia and one to Nemo and George. So for Julia, there were a few questions in the chat about the AAP and the community feedback mechanism. So some clarification on what was the difficulty for the population to access call centers, and how do we go beyond just collecting the information from the community and translating it into specific action. Yeah, let me leave it at that. And maybe if you have a few seconds to also the challenge of the data coordination around data for the response. Over to you, Julia.
Thank you. And it seems I have to sacrifice my camera in order to be able to rejoin this meeting. So sorry for not switching it on. It's impossible.
That's okay. Your voice is most important.
On the accountability system, why did this not work so well? Well, somebody counted over 70 different hotlines that work in the humanitarian system in Somalia. Now, that in itself, just imagine if you are a normal person in a village that tries to figure out which one of these to use for what. And quickly you'll see that, that's not very user-friendly. But then when we asked people, what's your experience when you try to use these hotlines? Many will say, okay, I tried to call this number, that number, that number, that number. Nobody ever picked up. That's not to say that that's the case for all of these, but there are too many where nobody will pick up the phone. Then when we ask people to say, okay, and in the cases where somebody actually did pick up the phone, what did happen is you get very, almost never an answer of people saying, oh, my issue was actually addressed. Something happened to deal with my concern. And what we understand is that the difficulty of taking the data that comes in, analyzing it, converting it into something useful of saying, okay, and now we need to take X step or Y step, handing it on to maybe the other relevant actor that this refers to is a huge challenge. And I think there were different efforts to introduce a common feedback mechanism that is independent and that really works on this analysis and referral and then getting action going. And this meets big institutional obstacles. Sometimes it's even the large agencies have policies that say you have, each country office in our organization has to have its own feedback mechanism. So it's not easy to address this thing, but I think it's something that is really important. And perhaps now that we have to deal with so much less money, maybe that'll help us to say, okay, here in this case, we can overcome these institutional barriers.
Okay, thank you very much, Julia. We have just a couple of minutes left, so George, maybe a minute for you and a minute for Nemo. We have a very big question, so it will be hard to, but please try. So the question is this: how can we use these insights from this evaluation to advocate, I assume with donors, but also with maybe senior leadership of the system, for reallocating resources towards innovation and long-term solutions instead of relying on what the report calls the short-term interventions, and how do we prepare the system to respond in a more coherent way in the future? Over to you, George, first, and then Nemo.
Thank you. That's a really tough question to answer in 1 minute. But I can say, we're working very closely with Somali authorities at the national and state and local levels to really push for a turning the corner towards a greater investment into better resilience and self-reliance, and that's genuine and concrete. Nemo mentioned the increase. Somalia has not benefited from climate investments in the way that other countries have. That's starting to change now, which is good. It allows us different types of investments. The new national transformation plan issued by the government is much more private sector focused in terms of the right types of investments that could hopefully reduce food insecurity, for example, in the future. And so I do think that there's some very clear opportunities that we can seize upon to really break this cycle of dependence on these punctual periodic needs for these large scale scale-ups, which have now happened. And the cycle of these has been getting shorter and shorter and more extreme. So if there was ever a time to change the nature of the spend and the focus of the investment exactly into, as was said, innovation, into new ways of doing business that actually break this cycle, that's exactly our focus for not just humanitarian actors who are focused on the life-saving, but really for the development community as a whole, for the peace-building actors and others. On the accountability to affected populations issue, the complaint mechanisms, feedback mechanisms, we get it, we're on it. Where we just discussed it. Well, we've discussed it a number of times in the past a year or so, but we took a number of decisions at last week's humanitarian country team meeting on how we're going to fix this. So hopefully this is not something that shows up in the future. I do agree, however, with Julia's statement that there was institutional resistance to harmonization. And the Humanitarian Reset actually includes harmonizing feedback mechanisms as a key part of looking at simplifying and harmonizing overall systems. So that's a bonus, because that creates institutional willingness to engage in a way that we found challenging in the past. Thanks.
Thank you, George. Over to you, Nima.
Yeah, great. Thanks very much. I think just to complement, I think definitely George, I've touched on some of the recommendations that I wanted to talk about. But one, maybe I'll start with the global and the institutional barriers. I think this is something that at your level, Ali, and at the headquarters level is really key for us to work together. In the country level, we need the support of the global leadership to work together. So it's the global leadership that needs to remove these institutional barriers. It shouldn't be about the institutions. It shouldn't be about our existence and our survival, but it should be the best way we need to respond and address the needs of the people on the ground, the communities that we support. So I think this mandates, I think, really need to change. And a lot of these big agencies, whether UN or INGOs, they are multi-mandated, so they can't work better together within. So I don't see where the excuses are. I don't see where these barriers are. Maybe it's politics. I don't know. But that's one big underlying recommendation. If we want to do something better on the ground for us as a team, as HCT, as a system, we need the global support to be able to enable us to do that. Another one is more equitable partnerships. We talk about equitable partnerships for local partners. Yes, we are in Somalia. We have access. We're providing access through the consortia to have local partners represented at the highest level of coordination structures and decision making, but that does not equate that they have the resources to be able to participate more equitably, but also to take those changes or recommendations into implementation, because the resource is with the smaller number of organizations in terms of the UN agency or the internationals. And then we need to use our knowledge as the humanitarian system to influence the development and funding portfolios. So we really need to do better at that. I know the nature of the humanitarian response is that we're all busy, we all have heavy schedules, and because of the nature and the response, but we really do need to take some time out to influence so that the development, the climate financing, all these other instruments are complementing the humanitarian response. The humanitarians cannot do everything alone, but we should be able to pass that message, pass that learning in a way that, brings about change. And again, George, you talked about it, but heavily engaging the government in these reforms, in these conversations, in these directions, so that there are no parallel conversations that are happening. And for us to have a political stability, I mean, insecurity and political instability has been the disease for Somalia, unfortunately, if I say that. So we advocacy, highlighting these issues is all we can do, I guess, as external actors. But we do need to emphasize the importance for us to change this cyclical, especially for those who support government, World Bank and the likes, to also have those political influences for us to enable to deliver a more principled humanitarian response and focus on that, and then have a complementary resilience, climate financing and development coming into the country as well, so that the communities, are uplifted out of this vulnerability that they've been in for such a long time. Thank you. And back to you.
Thank you very much, Nima. Thank you, George. A lot of excellent ideas, fascinating conversation. Thank you very much for that. I mean, I believe that, what comes across your points is that, the system can and should do more to perform better, but there's also a big chunk of work that needs to happen outside the humanitarian and development sector. So with the donors, with the member states, the whole global landscape needs to become more enabling for more effective humanitarian response. Communication, advocacy is very important. On our part, we will continue to disseminate the findings of this IAHE, and also telling the story about how the humanitarian country team and its local partners changing the system and what support they need. We will be doing a donor briefing in the month of May, and also we are working on the synthesis of all the IAHEs of the recent years to inform the humanitarian reset, and also we will hope that will continue to feed the conversation about the humanitarian reset evolution. With that, I'd like to thank you, Anima, George, and Julia for coming and speaking to us today. I also like to thank all those who joined online. There was a huge attendance today, so it was really appreciate everybody's time to come and staying with us today. I wish you a very good rest of your day wherever you are, and we will circulate the link to the report and to the recording in a couple of days to all of you. Thank you very much. Appreciate it. Thank you. Bye.